Good morning, dear colleagues. My presentation will be a little bit different than others because I'm an epidemiologist and I will be in this part mostly included in the process of immunization. And I'm, of course, presenter on these facts. As introduction, I was only to say a few words about human rights. Everyone knows that fundamental human rights are the right of life, and the right to health. It's, of course, very easy to say they are human rights, but sometimes in the practice, it's very difficult to really have these two rights. These two rights are very connected in between. They are also very connected with immunization program. For that reason, we decided to present this paper. Everyone knows that immunization is the most important achievement of medicine. And with immunization, of course, we save millions of lives on the global plan. There is one sentence from General Secretary of UN, Kofi Annan. Almost 11 million children die every year of preventable causes. Millions of people die when life-saving vaccines and medicines exist, but do not get to those who need them because they or the country they live in are too poor to pay or to distribute them. I would like to present the situation in Bosnia and Herzegovina. It's my country. During the war in Bosnia and Herzegovina between 1992 and 1995, of course, different human rights were violated, and as well the right to life and the right to health. From the aspect of immunization, there were few problems. First of all, first problem was providing the necessary vaccines, the cold chain maintenance, problem with the implementation of routine immunization program. We are almost 20 years after the war, but the consequences of the war and the consequences of this shortage of vaccines and everything that was connected with vaccines are visible even today. The aim of this paper is to show the trend of vaccine-preventable diseases. Of course, we decided only to analyze 3 diseases, morbilli, rubella, and parotitis. Measles, rubella, and parotitis, sorry. It's one retrospective epidemiological study. We use protocols, we use regular reports about vaccine-preventable diseases for measles, mumps, rubella, and for period 1994 till July 2014. And the place is only Canton Sarajevo. I would like very shortly to introduce my country. It's a very small country in the heart of Europe. There is about 51,000 square kilometers and about 4,600,000 inhabitants. We have 2 entities in 1 district. It's important because the health system is on the entity and district level. We have primary, secondary, tertiary health care and healthcare institution. And on this primary health care is on the municipality level. It's important because a routine immunization program is on the primary health care. Sarajevo is a capital city of Bosnia and Herzegovina, and according to the census from 1991, was exactly 416,000 citizens. Estimation for 2008 was 304 citizens, and according to new census, 2013 was 438,000 citizens. It's important that you know the number of diseases that you can compare with the number of citizens. It's very well known that the siege of Sarajevo was the longest in the history of modern warfare and the longest siege of the capital ever. It lasted 44 months from 5th April 1992 to last day of February 1996. There are a few pictures, and for sure they don't need any comments. During the siege, the city was almost completely cut from the rest of the country, and of course it was shortage of everything, even of food, of water, as well of vaccines. It was very dangerous to live in Sarajevo because citizens were often exposed to sniper fire, and this is on average for 329 missiles fired to the city daily. How to introduce and how to implement a routine immunization program in such kind of the city. Really, the immunization was completely disrupted. It was, first of all, shortage of vaccines, almost of all vaccines, and the second important part was maintenance of cold chain. Sometimes it was impossible, completely impossible, but the other things were also very, very important. How to bring children to vaccination without public transportation, without cars. But the other things is also important. It was really very dangerous and very risky to bring children to vaccination. And at the same time, a large number of children were orphaned. Of course, a large number of children were wounded. And immunization sometimes was completely neglected from the parents, to say sometimes from the health professionals. The other things were more important than immunization. Immunization against measles, mumps, and rubella are in ex-Yugoslavia and as well in Bosnia and Herzegovina introduced in the 1980s. And the first dose was given in 13 months of life, and the second dose with 6 years. There is one graph. You can see measles, mumps, and rubella from this period, from January to July, and you can see some peaks, special, these two peaks, these peaks are measles, and now again measles, with a large number of cases. I would like to talk a little bit in detail about measles outbreak 2014. First case was registered in the end of March, and it's still going on. It looks like so. You can see the epidemic curve. The highest number was in June, but we have cases till now. According to the age distribution, there is some very interesting things. The highest number is the age 25 months till 5 years, and the age 15 to 18 years. Also, this age group is also with quite high number. It's group 19 till 25 years. We divided all cases in 3 groups. First group is not vaccinated. It means people younger or children younger than 12 months and the people older than 36 years, because there is no possibilities to be vaccinated. They are too young and they are too old, according to our schedule. And the number of these people, or the percentage, is 7% in this group of cases. Vaccinated with only 1 dose, there are children from 13 months to 5 years, and this group for 25%. The group, the third group, are vaccinated or could be completely vaccinated. From 6 years to 35 years, it's the biggest group, 58%. There are possibilities, but in practice it's completely different. If you can compare, the number of unvaccinated is 94%. Unknown are 2%, incompletely vaccinated are 3%, and only 1% of cases are completely vaccinated. It's very good for vaccination program that we can say vaccination program is good, because it's really small number of vaccinated people which are at the moment with mumps, with measles. We divided all these cases in 3 groups. First category or first group, young people where the war did not have any impact on immunization because they are younger, from 15 years. Second category, people where could have impact on immunization, they are from 16 to 35 years. And third category, all the people where the war did not have any impact of immunization. They are older than 36 years. In first group is 51%, but we are interested for this group. There is 43% from this category, people where war could have impact on immunization even 20 years after the war. Of course, other colleagues are also have different publication for these topics, and it's very well known that during the war, completely health services are disrupted, and health effects on the war are different, but all authors stress that the big impact is on the child health, and the impact of the child health is, of course, not only immunization, it's also nutrition and other things, but the impact of the war on immunization coverage is very well known. And between many vaccines, measles are frequent consequence of the war because we know it's a very special disease. And of course, for this reason, we have also from our country, Hukic et al., an outbreak on rubella, because it's the same vaccine, morbilli, rubella, and parotitis, or mumps, in Federation of Bosnia and Herzegovina. And in conclusion, we can conclude that 43 of measles cases can be associated with war. Nearly 20 years after the war, we feel the consequences of it. In all emergent situations and crises, it's necessary really to pay attention to immunization as a preventive measure important to the future of each country. Security within a country is an important factor for affecting the delivery of immunization service. We know health is a human right, or we have human right to be healthy. But immunization is also a part of human rights. In order to respect these human rights, every country must make efforts. Thank you.
Any questions?
Thank you. Just wondering, after the country stabilized, did they not have any post-war immunization program come into effect? Like, people just didn't vaccinate to catch up?
No. We started with the routine immunization program according to our schedule. But catch-up program was only for poliomyelitis, for polio. It was catch-up. And now we will start with catch-up program with these 3 vaccines. It's a little bit too late, I know that, but it's true.